that I don't know. Stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
You're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you.
Oh, come on. If you would just
Don't.
try to say things. Keep on.
All right. So hopefully you got a little chuckle out of that. As we talk about depression, oftentimes there's this idea of being able to fix things. And so it's a good reminder that we need to slow down, because oftentimes just being present with someone and sharing space to hear what's happening is what somebody really wants. Not the fixer piece, right? And I see somebody in the chat there sharing, yes. About being a fixer. And oftentimes in relationships, it's not a bad idea to say, okay, if you're hearing some input, okay, so do you want me to listen or do you want me to give you advice, right? So just a fun way to start things off. But also wanted to kind of set the stage here about what we're seeing related to mental health. So this is a report that came out from the American Psychological Association, and it's showing the years from 2020 to 2022. And so we can see kind of the difference in how things are, the ebb and flow of what is being diagnosed. And so you can see here that anxiety continues to be the leading diagnosis by psychologists or therapists as well. And then it's followed by depressive disorders. And so you can see here there was a little bit of a spike in 2021, and then it kind of fell back in 2022. And of course, we don't have all of the data from 2023 yet, because of course, we're still in that present year. But also just to call out, you can see that trauma has really increased over time, as well as substance-related and addictive disorders. And so sometimes we see that these pick up and can really be, when we're talking about substances, really can be a way that people are self-medicating, maybe due to other issues that are happening in their lives. So just want to call that out as well. So as we kind of jump in, we know that 21% of adults experienced some kind of mental illness in 2022, which is about 50 million Americans. So, you know, if you or a loved one or a colleague has experienced any kind of mental health stressor, any kind of mental illness, you're not alone, right? The percentage of adults with a mental illness who report an unmet need for treatment has also increased every year since 2011. And over half of adults with a mental illness do not receive treatment. So that's a pretty startling statistic, right? That people are not getting the help that they need. And we're going to talk about how we are making things easier to access care. Suicidal ideation continues to increase among adults in the US as well. I know that the CDC released a report recently showing that suicides were at record numbers for the past year. The silver lining in that report is that we did see that the adolescent population did slightly drop. So I know that there's been a huge focus on our adolescents. And so that's some good news there. Rates of substance use, of course, are increasing, like I mentioned earlier. And so you can see there the prevalence as well. So almost 8% of adults in the US have some kind of substance use challenge. So if we're talking about depression today and we're going to break it down, we always want to think about, okay, how do I know that I might be struggling with depression, or how might I recognize that someone else around me is struggling with depression? And so it's good to have an understanding of what is sadness versus depression. We all have different emotions that we feel at different times, which is completely typical. And so how do we know that there might be something more than just sadness that's occurring? And really want to call out here, and if you're a note taker, wink, wink, you might want to just jot down that the duration of symptoms is really the key to the diagnosis. So if we are looking at how long somebody is feeling symptoms of depression, 2 weeks is when we start to really say, okay, this looks like it might be more than just sadness. This might be more than just some emotional components at play. And when we talk about these symptoms, it's important to remember that we are really looking at somebody's inability to function across their life. So that means, there's challenges in relationships, challenges at work, if a student, challenges at school as well. And really just that struggle to have ongoing functioning. And so an individual might come across as irritable, self-absorbed, maybe even angry. And some types of depression, like major depression, can be disabling and prevent a person from functioning normally. We know that depression is the leading cause of disability worldwide, right? So not just nationally, but worldwide. That's a pretty startling statistic sometimes for people to hear. And so as we think about how this impacts our workplace, right, we're talking about more than any kind of physical issue or diagnosis. It's really depression that can take somebody out of the workplace. And it can be a result of a variety of different factors. So it could be, maybe depression is something that runs in your family. Maybe there's a genetic component. It could be triggered by some kind of situation that occurs. So maybe really struggling to be able to function after the loss of a loved one. And maybe that inability to function is really elongated. Maybe there's a traumatic experience that happens that triggers depression. There could be psychological and biochemical factors at play as well. So what would we expect to see in the workplace? Well, an individual on an individual level, they might experience persistent sad, anxious, or an empty mood. And for all of these, we're really looking in a change in someone, right? So something that would make us pause and go, I wonder if something's going on here. An appetite, any kind of change. So whether it is reduced or increased, as well as sleep. So sleep is a factor here if we're looking at reduction of sleep, the inability to sleep, as well as sleeping a lot. Restlessness, irritability, difficulty concentrating, impaired judgment, fatigue, or loss of energy, right? All of those are symptoms that someone may experience. And again, if we think of, even if we think of, my daughter is almost 13, like, teenagers experience all of these, it doesn't necessarily mean that they're experiencing depression. So it's important to then have a conversation once you recognize that something might be going on, but it's definitely a challenge, right? So in the workplace, it might look like decreased productivity. Maybe some morale problems, lack of cooperation with teammates. Maybe somebody starts to really take risks that they hadn't before. Maybe there's more injuries or accidents depending on what's happening at the workplace. And maybe individuals are calling out more. They're just physically saying they can't come to work. There could be frequent statements of being tired all the time, complaints of unexplained aches and pains. Again, if we're talking about children, it could be stomach aches and headaches are often signals that something might be going on. And then I mentioned earlier, but again, that self-medication. So maybe alcohol or drug use or abuse could be occurring as well. And so we're going to watch another video. This is Hannah Hart. She is an individual that is diagnosed with depression, and she shares her experience as well here.
Hi, I'm Hannah Hart, and I'm here to talk if you're willing to listen. So I lived my whole life without knowing that depression was a real thing. I thought depression was like kind of the same thing as being sad or bored or whatever. As I got older and my life got bigger and broader, I still kind of carried what felt like a lead jacket with me wherever I went. Like there was this inherent sense of sadness that no amount of talk therapy was seeming to sort through. Eventually, I started going to a different therapist, and she was like, "Well, it just sounds like, you have depression." I was like, "Oh, so now what?" I personally did a lot of research. I started reading about it, and I found a lot of like-minded people that were like, "Oh my God, you experience the same thing. There's not just something wrong with me." And as I started to realize what was going on with me, I was able to express it better to the people around me. One of the most important things to remember if you're reaching out to someone you love who's keeping something inside is patience. And don't get frustrated. And if the conversation doesn't go well, don't feel like, "Oh man, I did this." Set your intention before you even pick up the phone. And for me, it's no matter how this goes, it's not about me. I'm trying because I feel compelled to try. And I'm going to do my best, and I'm going to listen. A good rule of thumb: listen twice as much as you speak. If somebody wants advice, they're going to go, "I don't know. What do you think I should do?" That's when you tell them. I feel like we have a tendency to want to fix problems and solve and give people advice. "If you just did this, and this, you'd feel better." Okay, great. Thanks. It's resolved. Chick. And I do this too. But that's only because we don't want to see the person we love suffering. But unfortunately, sometimes we have to let them suffer in that moment so they can let their suffering out. If somebody's starting to cry and it makes you feel really awkward and really uncomfortable, just sit with it, man. Because odds are they need to cry. Your friends want to help you. Your friends want to be there for you. They just don't know how. For instance, my partner's like, "Why can't I make you happy?" And I'm like, "This is my happy." So it's okay to take some time and research what might be the right thing for you. When I'm really stressed out or I'm really feeling not my best, I just need someone to be like, "Yeah." And then I could be like, "Yeah, word vomit, word vomit, word vomit, word vomit." And then I'll feel better. It's not about telling every single person in your life, "Hey guys, I'm depressed today." It's about finding the support in your life so you know who to tell. That way, they can be there for you and you're not just alone in the feeling anymore.
All right. I love that video as well. And so as we listened to Hannah Hart and her experience, I also wanted to take some time to get your feedback as well, and hear from you about maybe how you might respond. So if we are thinking about someone in our workplace, and in this situation, her name is Amelie. She's in her 40s. She lives with her husband, 3 children, and mother. And lately, she's been struggling with the responsibilities of being a wife, mother, caregiver, and professional help. I'm sorry, unprofessional. The crying spells, lack of energy, irritability, and inability to sleep are more frequent, and she does not know why she feels that way. Lately, it's been very difficult for her to meet deadlines as other employees do. She thinks she can handle it and everything will get better on its own. However, she's been waiting for things to get better for over a year. And so just wanted to kind of start this conversation and ask, if Amelie was your colleague, what might you say to her? What might you do if you recognize that maybe she might need some support? So feel free to jump into the chat here. It looks like I see somebody's hand raised as well. If you wanted to take yourself off of mute, you could go ahead and do that as well. And it looks like we have some folks sharing here. Oh, sorry, go ahead.
Basically, if being a colleague, I most likely at first would probably have a conversation with her to see exactly where, and probably offer her to have, get counseling. Because I can kind of understand and relate to some of these issues, because I have been going through some of these issues myself as well. Because sometimes you just feel alone. And if someone does come in, it can kind of help a lot to know that you're at your first step of getting it out, getting some of it out and knowing what would be your next step thereafter. So if you have somebody to kind of communicate with, this will help along the way. So if someone can actually notice or, come to you and talk to you, this can help open up, and kind of relieve some of what's going on and to push you forward to getting further assistance with what you have going on.
Yeah, I love that. Thank you. Thank you so much for sharing. So
Well,
the first thing was recognizing, right? Recognizing that someone might be struggling. And I'm even seeing some comments in the chat that echo some of the things that you said. Sharing your own experience, and sharing what supports are available, what has worked, and really just asking how she's doing, right? And listening. Yes. And I'm also seeing somebody shared Champs is available, and also can help with similar issues. I'm not familiar with Champs, so hopefully you all know what that is. But yes, so really when we talk about all of these different diagnoses or signs to look for, it's not that you need to feel this burden to become a therapist, right? It's really to understand and be able to recognize when somebody might be struggling, and just to have a conversation and say, hey, I'm noticing these things, and I just wanted to check in and see how you're doing, and remind you about some of the resources that we have, right? Yeah. So thank you. Thank you so much for sharing, everyone. And we're going to take a moment here. If you have questions, we are going to also share some resources following this questions piece. So maybe as you're thinking about some questions to ask, you can put them in the chat, and then we'll come back to them here shortly. So I'm going to hand it over to Dante to talk about some of the resources that are available to you.
Yeah, so you could register for therapy or psychiatry at talkspace.com/gatorcare or by scanning the QR code. Therapy is available to members 13 years and older, and psychiatry is 18 years and older. And this is also cost to you.
And just to kind of call out the difference between counseling and psychiatry. So psychiatry is really the practice of medicine, and it's being able to give medication. Sometimes people will engage in therapy and they need something else in addition. And so medication has been found to be effective. Some people also start with medication. Maybe later they switch over to therapy as well. What's really been found in the research is the combination of the two has been the most beneficial. So you have some amazing resources that are available to you. And as Dante mentioned, at no cost. So, all right. Dante, do you want to explain this piece as well?
Absolutely. You can go ahead and scan the QR code to earn your wellness credits, or go to the link and then take the quick little quiz.
Yeah, so I'm going to leave this here for a moment to make sure everybody has time. And as you're also thinking of any questions, if you want to come off mute, if you want to put it in the chat, we are here for questions as well. All right, so somebody asked about scanning the code while in the Zoom, and I see that Krupa listed the link there for you as well. All right, so here's a question that just came in. It says, why is low energy part of depression? Yeah, so, the link says it's for Meatless Mondays. All right, we're gonna work on that piece, and I'll answer this other question about low energy being part of depression. So we mentioned that You know, many people can experience different symptoms related to depression. And oftentimes low energy is one of those. And if you think about really this feeling like it's hard to move. Some people have described their depression as feeling like they're in quicksand or a body of water where everything is kind of delayed. And so just being present sometimes can really be draining for energy. It can be something related to the chemicals that are happening in your brain that are part of that. It could also be part of your mood. So if you think about times, even if you're just feeling sad, sometimes you also have some low energy there. And so it could be a variety of different reasons that's all part of depression. Again, everybody has different symptomologies, but that is a common piece here. And Dante, were you able to figure out this link here?
You can just fill it out, it's fine. I'll know who joined today's webinar. Sorry about that confusion.
Thank you, Kripa.
Thank you. All right. Any other questions? Okay. Also wanted to share with you just a couple additional resources here. The Suicide Lifeline being one. So this is 988. It was developed a little over a year ago now. And it was really in response to individuals calling 911 related to some kind of mental health need. And so, of course, our first responders really wanted mental health professionals to be able to respond to some individuals that they felt like, you know, mental health professionals maybe were better equipped. And so this number was put into place. So as you can imagine, 911 being for other emergencies, 988 being for any kind of mental health need. And so this number is going to recognize the number that you're calling from and route to your local call center, if you will. And so oftentimes, depending on your community, there are also resources available to deploy things like a mobile team. So mental health professionals that are able to respond in person to some kind of crisis. But also want to stress here that you can call this number. Maybe you want to practice having a conversation with someone. Maybe you say, you know, I had this training a bit ago and I'm not really sure what next steps I should take. So I just want to talk this through with someone. This is a great resource, calling 988. Also, you can text this number and it's also available in Spanish. So doesn't matter where you live across the nation, that number is available to you at no cost. This is not a Talkspace resource. I just want to call that out as well. This is something that is funded by the government. And then an additional resource that is from Talkspace is listed here. This is a great resource, has a variety of articles, blogs, research, webinars, to be able to find maybe some kind of topic that you're looking for. Maybe you're a parent and you're struggling with something with your child. You can look up some resources there. You can also look up, again, just really a variety of topics, like if you're curious about trauma, maybe, you know, we're seeing all sorts of horrible things happening in the Middle East right now, and you're not sure how you should speak to your children about that. There's articles there as well. So just really a variety of topics for you to access for free. You don't need to even be part of Talkspace or be receiving services. You can access those at any time. So just wanted to leave you with that as well. And we'll stay on here for another minute to see if there's any other questions that come through. But really appreciate your time and for you tuning in and taking a moment to learn about depression. Part of really trying to take away the stigma is education. And so by being here today and learning more, really, you're also helping to reduce that stigma. So we appreciate you, and we hope that you have a great day.
And I want to say thank you once again to Laura and Dante for joining in today from Talkspace to give this special presentation. Thank you both.
Thank you.